I think tackling the ethnicity and race pay gap in organisations in the NHS is pretty critical, isn't it? I mean, at the end of the day, the NHS, if it isn't about fairness, equity and equality, what is it about, right? And what can be more kind of clear than if you're not getting paid what you should be because of the colour of your skin or your ethnicity? I mean, it's pretty basic. It's like, you know, line one, book one of the How to Run an Organisation. You know, we got to do what we say, and I think pay is pretty critical. Yeah, I've learned so much. To say one is almost impossible. I mean, it's like, what? I think one of the things I've learned is how clear it is and how big the problem is. You know, when we set up the RHO during the pandemic, and we did the work on pulse oximetry, I think I wasn't expecting that to be so you know, to come across that so quickly and so powerfully. Then we do the work on pregnancy and the treatment of, you know, then we do the work. It's like, it's so kind of clear that this isn't a kind of some sort of strange political problem. It is here now. It's operating against the wishes of NHS leaders, and it is taking value off the table for too many people who pay the taxes for an NHS that should treat them equally and with equity, whether they work here or a patient or both. So what I've learned is that this is a big challenge. This is not something that you can just sort of sweep under the table or avoid. It's fundamental to the efficacy of the NHS. You know, I mean, I didn't think it was a minor issue when I set it up, but the extent to which it is an issue and the extent to which it pops out virtually everywhere, that was some learning. This is not something that can be passed off. It is a clear and present danger. I mean, I kept talking to people who would tell me that this issue was too controversial, political, not an issue for the NHS. They didn't have the evidence base, they didn't know what to do, they didn't know how to do it, even when they did have the evidence. And then, of course, the pandemic came. I mean, to be fair, I'd been calling for the setting up of the RHO well before I co-edited the BMJ edition, which called for it as a recommendation. But it being ignored, set aside. So it had to be set up. I call the RHO two things: an excuse remover and a mirror. You know, if we say what we say we should be doing in the NHS and social care system, then this is the mirror that says, are you doing it? And if we say we don't know, these are the people that say, actually you do, this is the evidence. The only reason for not doing it is not because you can't, it's because you won't. The first thing I'd like people to take away is that this isn't a political issue, you know, and it's not a kind of a moral choice either. You were either a good leader, and you know, forgive me for repeating it, but I say it all the time, you're either a good leader, in which case you're leading all the people everywhere all the time, right? Or you're not, in which case you're leading some of the people somewhere some of the time, and you should be paid accordingly. You know, it's not difficult. So I'd hope that people will take away from this that this is about good leadership and good management. It's not rocket science, and it's, in that sense, it's about doing your job or not doing your job. You can call it what you like, but that's what it boils down to.